Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. It affects millions of women worldwide, yet remains underdiagnosed. Endometriosis is a chronic disease in which tissue similar to the lining of the uterus grows outside the uterus. This leads to inflammation and scar tissue and can cause severe pain. The World Health Organization says endometriosis affects 190 million women of reproductive age globally. A Nigerian non-profit is leading a campaign to raise public vigilance and help women cope with this painful condition. Timothy Obiezu reports from Abuja.
20 years ago, Sharon Nkechiado experienced her first menstrual cycle at the age of 15. And every month since then, when her periods come, the pain is so severe she has to be hospitalized.
My mom specifically, she didn't take it to be a serious thing. So I keep managing it down to my university. Emotionally, it's always something else because sometimes you get to a point where like, why this?
The World Health Organization says the medical condition endometriosis affects 10% of reproductive age women and girls globally. It causes severe pain in the abdomen and pelvis and could elevate the risks of infertility by up to 50% in women. But despite the threat, a lack of accurate data on its prevalence in sub-Saharan Africa has led to underdiagnosis and low reporting compared to Europe and the United States.
We have about 30 to 40% of our patients are endometriotic. That's women who are in their reproductive age. And it's also believed that 11% of our pupils also have undiagnosed endometriosis. The stigma here is that it's very, very unreported because of lack of knowledge about the disease. That's number one. Because of lack of knowledge about specialist diagnosis of the disease. Because the disease is also, the investigative procedures to diagnose the disease is expensive and it's not mostly available in most regions of Nigeria.
Many here also don't view endometriosis as a significant problem. That's where Olivia Nwankudu and her nonprofit EndoSurvivors International Foundation come in. She launched in 2017, years after learning about her own condition, to raise public suspicion and increase diagnosis.
When a young girl walks into a doctor's office presenting with severe period cramps, endometriosis is not usually the first thing on their mind. So I just thought that other women should not suffer as much as what I suffered. And we also do some training for doctors, for primary care doctors, so that they can increase the index of suspicion for endometriosis.
The foundation has helped more than 2,000 endometriosis patients access care and takes awareness to thousands of schoolgirls. It also holds periodic support meetings to help women suffering emotionally.
When I joined and I met other women, that our stories are almost the same. It feels like we're living the same life. And I just felt relief, like, okay, I am not alone, I am not crazy, I am not overreacting.
It just gave me a sense of belonging, knowing that I am not alone in this journey. I have other people that have these similar experiences with me.
Nwankudu says without much government and private sector support, it will be difficult to spread awareness about endometriosis and many more women could be worse off. Timothy Obiezu, VOA News, Abuja, Nigeria.